guys want to hear about TCAB? Let's do it.
What has TCAB done for me? TCAB has really fulfilled and enriched me as a nurse. It truly has.
Yeah, you definitely feel empowered in your position.
I love TCAB. I am a TCAB fan.
You're spending more time at the bedside, talking to the patients, doing things for them and with them.
Awesome, empowered, great, strong, confident.
Transforming care at the bedside, also known as TCAB, has truly transformed how care is delivered to the patient. In 2009, Southern Maine Medical Center was very fortunate to receive a grant from the Robert Wood Johnson Foundation to implement the Transforming Care at the Bedside program on the Med-Surg unit. The collaborative consists of 16 hospitals from all across the country and is a component of aligning forces for quality. TCAB has provided the tools for frontline staff to initiate improvements, utilize rapid cycle change, and monitor success with a measurement by using the PDSA model: plan, do, study, act. The TCAB components, patient-centered care, value-added care, safe and reliable care, and team vitality provided the framework for the changes and improvements.
TCAB has helped our team vitality tremendously.
You feel like you have a voice on the unit.
Everything is staff-driven, staff initiatives, us working through all the kinks of everything.
A lot of good ideas come from people that you wouldn't expect it to. So
It gives the nurse, and any nurse, the power to say, you know what, I want to communicate better with my patient. So in order to do that, I think I can do this. And that initiative can be brought to life.
I think it's better coming from us versus being what they call top-down. It's our practice.
I have worked at other hospitals that have not been doing the TCAB, and by far this has been a much better experience.
Before TCAB, there would be new ideas that would come down from nursing, from management above, and we were told this is how it was going to be, how it would be done.
There was no process. Our staff had great initiatives, great ideas, but there was no avenue to go about implementing them.
Within the first 3 months, when we started really watching our fall rates drop, you feed that right back to the frontline staff. This is what you did. This is a result of the changes that you made. And that's what keeps the momentum going, is that continuous monitoring, the continuous measuring, the importance of the PDSA cycle.
Red Mat is designed to prevent medication errors. We have a red mat in front of every Pyxis machine, which is the machine where we get medications from. When a staff member is standing on that red mat, you are not to be interrupted for any questions or anything until they come off that red mat. Whiteboards are our communication tool with family members, with doctors, multidisciplinaries, with the patient. It's got the doctor's name on there, the nurse's name on there, the CNA, the date, their diet, their activity, how they transfer. A big area for messages if family members want to leave a message for their patient, their loved one. Dad, I was here, you were sleeping, have a good night. Anybody that's involved in taking care of that patient can use that whiteboard.
A safety bundle is for all patients deemed moderate to high fall risk, and it contains a yellow falling star magnet for outside the door, a yellow wrist bracelet, and a double-sided grip yellow socks. You can see it on the wrist, the socks, and outside the door. You know someone in that room should not be getting up without help.
We initiated portable phones. Each bedroom has them. The nurse can call the doc right from the phone, page them through the hospital operator, put the phone in her pocket, go back to patient care, seeing your patients, doing your thing. The doctor would call. You can pick the phone right up out of your pocket, talk to them, get your orders, get your things taken care of, and done.
We're building leaders for the future. Now we're finding that most of our med-surg nurses are working towards certification. They are taking on leadership roles, which are more than just becoming charge nurse of the day. They're leading quality improvement teams, and they're truly engaging the new staff as they come on in process changes.
people who have an idea, like you have some people that will have an idea and they're like afraid to say anything because they're afraid their idea will be shot down. With the TCAB process, your idea doesn't get shot down.
Now that they've seen the results and our satisfactions, our fall rates, it's really hit home that this does work.
The complexity of patients at the bedside, we need those leaders at the bedside.
If something in your idea doesn't work, you try something else until you get it to work, because if you really believe in your idea, it will happen.
So TCAB works?
TCAB works.